Well, good afternoon. Earlier today, General Hillier and I met with Ministers Elliott and Jones to discuss plans for the rollout of COVID-19 vaccines in Ontario. I want to again thank General Hillier for agreeing to oversee our vaccine task force. This task force will be responsible for the largest vaccine rollout in a generation, a massive logistical undertaking, the likes of which this province has never seen. Because as soon as these vaccines are available, we have to be ready. We need military precision. And General Hillier, he will bring the same expertise, the same disciplined leadership to this mission as he has to every other national and global engagement throughout his distinguished career. But my friends, make no mistake, this will be a monumental effort. When you look at a province the size of Ontario with as many variables as we're facing, without proper planning, without proper information, this could be a logistical nightmare. That's why, as we continue planning, we need certainty from the federal government. We need to know which kind of vaccines we'll be getting, because each vaccine will come with the unique requirements and potential challenges. And we also need to know how many vaccines we'll receive each week. We need a clear line of sight into the timelines of the shipments. Without a clear understanding of how many vaccines we'll get, it's impossible to plan how many staff we need, how many trucks we need, how many freezers we need. My friends, the federal government is responsible for procurement of this vaccine. But as the provinces, we will be the ones distributing the vaccine across Ontario to our frontline partners to administrate it. So our role in this is critical. We are the last and most important link in this chain, and also the most complicated part of this rollout. So we need to work closely together to ensure we are prepared. These are questions I posed to the Prime Minister last night. I told the Prime Minister that we need answers and we expect answers, because we can't have Canadians watching as our allies start getting vaccines without having a clear answer on when we will be getting it. And my friends, the clock is ticking. We can't be last in line. The Prime Minister assured us, all the premiers, that these answers would be coming. And I take him at his word. We're ready to work with him, and we stand ready to do our part. And we will work with him every single step of the way. Because people expect us to work together on this. Nothing is more important right now. We have to work together to get these plans in place, to get this vaccine distributed as quickly as possible. Because the sooner we get a vaccine, the sooner we can protect our frontline staff and most vulnerable, take pressure off our hospitals. The sooner we get this vaccine, the sooner we'll get life back to normal. The sooner this awful pandemic is over. And with the support of General Hillier, with all of us working together, we will accomplish this mission. We will get the job done, and we will get through this. Thank you, and God bless the people of Ontario. I'll hand it over to Minister Elliott.
Thank you, Premier, and good afternoon. We are in a critical new phase in our efforts to stop the spread of COVID-19 with the recent news about the Pfizer, Moderna, and now the AstraZeneca vaccines. The COVID-19 vaccines represent a light at the end of the tunnel and a way out of the pandemic. As we continue to build on the work we've been doing to prepare for the largest logistical undertaking in the province's history, it is imperative that the federal government lay out its plan to allocate COVID-19 vaccines across the country. Our success, our country's success, to defeat COVID-19 is dependent on receiving this critical information so we can continue to properly prepare and ensure Ontario is ready to receive, store, and administer the vaccines in an ethical, timely, and effective manner as soon as it is available. The challenges are considerable. The COVID-19 vaccines require special handling and storage. The logistics will have to be well thought out and planned. And these plans will be dependent on the volume and timing for when Ontario will receive its allocations. And most importantly, it requires coordination and collaboration with our federal, provincial, and municipal partners, with our manufacturers and distributors, and with our healthcare providers across the province, so that as soon as we get our vaccine doses, we can get them in people's arms as quickly and safely as possible. I know we can achieve this based on the dedication and effort I have seen to date in our province's pandemic response. And we're confident that General Hillier and the Minister's COVID-19 Vaccine Distribution Task Force are the right team to help us address the logistical challenges of this historic undertaking. This is a critical stage in our fight against COVID-19 that will require us to work together as a province and as a country to face the challenges ahead of us to protect the health and well-being of each and every Ontarian. And until such time, when we have all been vaccinated, we will continue to urge everyone to please follow public health advice, especially as we approach the holiday season. Please wear a face covering when physical distancing is a challenge. Maintain 2 meters apart from others outside your household. Wash your hands often, and stay home if you're not feeling well. Now more than ever, everyone must follow the public health advice and adhere to restrictions in your region. We will get through this together. Thank you.
Okay, we'll go to the phone line for questions. First question, please.
First question comes from Lucas Meyer at News Talk 1010. Please go ahead.
How you doing, Lucas?
Thank you very much. Hello, thank you. General, based on the conversations you've had so far, what you've been able to research, do you support and believe in the target for those first vaccines for vulnerable groups and frontline workers to start in January, and the majority of the population, including Ontario, will be by September, General? Do you stand by those targets?
So over to the General.
Well, thank you for that question. So first of all, I'm not the one that's going to make the decisions on what the targets are. There's guidance that's come from the federal government, of course, and this is the work of the elected leaders of Ontario who are doing that. Yeah, I do think it's right that the vulnerable get access to the vaccines first, and then those that are closest to potential COVID-19 sufferers and who could catch and then retransmit that disease should be right up there in that order of priority. I don't know if that'll start in January or not. I will wait to see when the vaccines arrive, but as I told the Premier this morning, our mission is clear. We want to have our task force ready, building on the incredible work of the people over this last weeks and months here that we got a chance to listen to and talk with and question and discuss things with yesterday and today, building on their incredible work to be ready for 31 December. If things arrive on 1 January, which obviously the Minister of Health and the Premier and the members of the government, and I'm sure the people of Ontario would love, we're going to be ready to ensure that we receive it, that we distribute it, that we handle it appropriately, that the medical professionals who are going to ensure that the vaccinations occur are ready and equipped, and that the public is aware of what's going on and ready for what their role is to play to get vaccinated and get protected, and that we can track it then from stem to stern, so to speak, as we're doing that. Our mandate is clear. We're going to be ready for 31 December. I think those priorities are right and logical. I think most people would support them. Thank you.
Follow up?
Thank you. And General, another one for you. So take us into what you are looking at personally in terms of your role in this. What is the biggest challenge for you? What is your biggest, the biggest hurdle that you have to clear? And how far are we in terms of preparation at this point? How much ground do we have to cover, even at this point?
Well, let me just go back and answer the second question first and say we're a long ways towards the preparation. I listened yesterday and walked through and we questioned closely, very intense discussions about what we've done on the logistics and preparation distribution side, what we've done there, what we're planning to do and what we're thinking about planning and getting to do. We talked to the medical professionals about all the issues that they have. We've talked to the public communications folks on how we can ensure that the people of Ontario are educated, understand that we're transparent with them, and that they know what's going on and what their role is in it. And then we talked to the IT professionals to ensure that we can do the necessary tracking to make sure that we don't waste a single vaccine, that we don't miss a single person who wants to get vaccinated, that we want vaccinated, so we can get back to a normal life. So there's a huge amount of work been done. We're a long ways towards what we want to be and the readiness that we want to have. The team that we're bringing together now, the Secretariat, it's an integrated team. There are a couple of people that have come with me, former military planners who have worked on operations around the world and in Canada. And we have been combining these last days with the people from the Ministry of Health and Solicitor General, building on the good work that all of them have been doing, and it is good work, I'm going to say that again. And our role is really to tie the strings of those 4 lines of operation together and make it one very coherent operation. So it's not just distribution and logistics, and it's not just a medical piece to vaccinate folks, and it's not just an education to the population of Ontario, and it's not just tracking. It's all of those things that we need to tie together in a coherent operational plan and then execute it so we have an efficient operation that gets the vaccines out to the people of Ontario and get them vaccinated as soon as those vaccines show up for us. That's what we're doing now. We got a couple of milestones set for ourselves to reach next week. The week following that, we want to do some exercising to stress what our plan is and how our team is. And you know, when you say 31 December, you kind of want to be ready by Christmas Eve, because Christmas to New Year's is always a bit more challenging, no matter how dedicated you are in getting ready. But we are going to be ready for 31 December. You know, it is an unknown when the vaccines arrive. Both the Premier and the Minister talked about that. In the military, we've operated all of our lives with the unknown. And so what we do is plan for worst case, plan for kind of everything arriving on the 1st of January. If you can handle that, you can handle anything going forward from there. And so that's what our work entails right now, and that's where we're going. The team is being built. It's largely present and in place, and they're building on the work that's been done. And I'm not an over-the-top optimist. I'm a pragmatic person, but we're going to be ready on 31 December for what the people of Ontario will need from us.
Next question.
Next question comes from Matthew Bingley at Global News. Please go ahead.
Hey, Matthew.
Hi there. General, I'm just wondering if you can tell me, when it comes to the actual logistics involved in this, including the refrigeration, do you foresee the rollout of people being vaccinated as being something like with the satellite locations, like we see with people getting tested?
First of all, you know, I don't really want to speculate about the actual details of the vaccination, but here's what I would say. We're looking at everything. And we're doing that with the professionals that do this. This is not their first rodeo. They've done flu vaccines, they do shingles vaccines, they do pneumonia vaccines on a routine basis in huge numbers, so there's a lot of good history to build on. I had the opportunity to speak last night with Chief Matt Pegg from obviously from the City of Toronto, the Fire Chief and COVID-19 Task Force leader, and to walk through what he's thinking, what he's planning, what work they've done. We obviously are going to be working very closely with the municipalities, because, you know, this is a job that spans every single person in the province, and we want to be able to reach out in the most efficient manner possible. So we're looking at all options for vaccinations, vaccination sites, and how we'll do it, and tie all that together in the coming days here. So, like I said, so we're ready on 31 December. I think that's about as much of the specific parts of it as I could tell for you. Did that answer your question?
It does. And I just have a follow-up for Premier Ford.
Excellent.
Premier, there are still many issues with people trying to get a flu vaccine. A lot of the messaging that you're saying right now is quite similar to what you had said about the rollout of that vaccine, and people are obviously still having trouble getting it. So how can people have confidence that this rollout will be any smoother?
Well, we have pharmacies right across this province giving out these vaccines. We've ramped it up, I should say. We ordered an additional 1 million vaccinations, and I'll pass it over to the minister. I'll tell you, there's one thing to talk about the flu vaccine, And then there's another area that we talk about, the COVID-19 vaccine. I have 100% confidence in General Hillier and his team. This will be done. As General Hillier says, this mission will be accomplished. There will be bumps in the road, but I have 100% confidence in General Hillier.
Well, I also have 100% confidence in General Hillier and his team, and I know that they will be ready, and we will be ready as of December 31st to receive the first shipment of the COVID-19 vaccinations. As far as the flu campaign is concerned, we did order almost 1 million doses more this year than last year before we even knew that COVID was going to be coming along. So we have been very successful with that campaign. It's been the largest flu campaign in Ontario's history. We have made sure that over 5 million people have received the flu vaccine. We are obtaining more. We've just received 142,000 more doses from Sanofi, and we are working with global manufacturers to receive another 1 million vaccines that should be available in very short order. So we want to make sure that we can complete the vaccination program and be ready with the COVID vaccination program.
Next question.
Next question comes from Rob Ferguson at the Toronto Star. Please go ahead.
Hi, Rob.
Yes, this might be best directed to Minister Elliott. I understand that a vaccine for children has not been approved yet. So what are you expecting on that front, and what kind of a monkey wrench might that throw into everyone's plans, given that the Prime Minister said today he expects about half the population of Canada to be vaccinated perhaps by September?
Well, you are 100% correct that both of the Pfizer and the Moderna vaccines are not available for anyone under 18 years of age. However, there are a number of other ones that are close to being finalized and being ready to go, and we certainly hope that there will be some that can be used to vaccinate children, because if we want to get rid of COVID, we are going to make sure that anyone in the population across Ontario that wants to receive the vaccination will be able to receive it.
Follow-up?
Yeah, thanks, Minister. Just switching gears, I want to drill down into these numbers a bit. We did have a kind of smashed through the record high of below 1,600 by about 250 new or more infections. This was on really high testing of 58,000. So what is the thinking from the medical experts in the ministry on this? Are we up that high because we did have so much more testing? Is there something else going on? What can you help us with on that?
Well, first of all, we do recognize the numbers have jumped up there, but we've set record testing numbers again, and it just shows our capacity of over 58,000 tests. No one in the country's ever done 58,000 tests in one day. I want to thank them, and again, I've said it many times, they're running like a well-oiled machine. The testing folks, I want to thank Matt Anderson, his team, Public Health, and everyone involved in that. I'll hand this back to Minister of Health.
Thank you. But it's not necessarily just because of the increase in the number of tests that we're seeing the increase in the number of cases. We expected that there would be an increase since Peel and Toronto were put into lockdown. It is going to take probably 2 full weeks before we're going to start seeing those numbers go down, because we're still seeing the results from some of the events that have happened and some of the celebrations that have happened in the last few weeks. So we anticipated that the numbers would go up first before they started coming down, and that is what we're seeing with the numbers. But we're also taking a look at all regions across Ontario, and we're trying to act quickly so that we can make changes earlier, moving some regions from green into yellow or into orange or into red, whatever the case may be, early, so that we can take action, get the numbers down faster, so that we don't have to go into lockdown and we don't have to go into businesses shutting down. So all of this is important. We are reviewing it on a daily basis, and there will be further information forthcoming later this afternoon on that.
Next question.
Next question comes from Colin Perkel at Canadian Press. Please go ahead.
Colin.
Thank you for that. This is for the Premier. So just following up on the numbers, though, we've seen these increasing lockdown measures and restrictions placed on folk. But, is it actually working? Are people buying it? And we've even got an independent member of the provincial parliament being ticketed for protesting against these measures. Is anything going to work, or what can you say about that?
Well, we're confident anywhere around the world when they have measures like this, we see the numbers go down. From our experience, I think that MPP, Randy Hillier, is being totally irresponsible, protesting outside Queen's Park. Again, the anti-maskers. Folks, we're here to make sure we protect every single person in this province, even the anti-masker folks that believe this is just a big hoax, which, again, I've never figured that out. This is a very serious virus. We're seeing it around the world and around our country, but we're going to be there to make sure we support the health and safety of every single person in this province, no matter if you're an anti-vaxxer or anti-masker. I'm still there. I'm going to protect you because I have to protect you. I got to protect your families because someone maybe within your family, maybe your elderly grandparents don't agree with what you're doing. And God forbid they ever get this terrible, terrible virus. We're all in this together, and I'm going to make sure that I protect every single person in this province, and I will not spare a single penny doing it as well.
Follow-up?
Given again today's 25% spike in numbers, are these measures actually effective, or is our only way out really the vaccine that you're looking forward to?
Well, before I pass it over to the Minister of Health, as the Minister just said, there's been a lot of celebrations over the last couple of weeks. We'll have a better idea as we move forward, days moving forward or a week moving forward, if this is working or not. I truly believe it's working, because how can you put a number on it if we didn't do this? If everyone was just out there not following protocols and guidelines, it could be a lot worse. And the proof is in the pudding. When we did it last time, we were down to almost 100 cases, which is unheard of in a population of 14,770,000 people. Again, look at the states to the south of us that want to ignore the regulations. They're blowing up. They have mobile morgues driving around in Texas collecting bodies. And now, if that's not a wake-up call, I don't know what is.
Well, the vaccine, of course, is going to make a huge difference, but it is going to take time for everyone in Ontario who wants to receive the vaccination to receive it. But in the meantime, it really is important that people continue to follow the basic public health measures, as I've outlined, the maintaining the physical distance, wearing a mask when that's not allowed, where you can't do that, or where it's mandated, washing your hands thoroughly and carefully, staying at home if you're not feeling well. These measures do make a difference, and as the Premier indicated, during Wave 1, we were able to get the numbers under control. We were able to bend that curve, and we can do that again, but we need everyone to please follow these measures. Please follow the rules in your regions. That's how we're going to do this, and we know that if we do it, we'll be able to bend this curve too and beat COVID-19.
Next question.
Next question comes from Brian Lilly at the Toronto Sun. Please go ahead.
Hi, Brian.
Hi, Premier. A question for you and for Mr. Hillier, General Hillier. I know that you were looking for some clarity yesterday from Prime Minister Trudeau. I'd like to know if you got some of that clarity on the phone call from your comments earlier. It doesn't sound like you did. Mm-hmm. And for General Hillier, the announcement of Danny Fortin, does that make you feel better about working with the feds, that you'll be working with another old military guy in trying to deal with the rollout?
So to answer your question, I didn't get the answer we wanted to hear. None of the premiers got the answer they wanted to hear. But in saying that, I'm going to take the Prime Minister for his word. He has mentioned stuff in the past and he's pulled through. But I can't emphasize enough to the Prime Minister, the clock is ticking. We're going to be hopefully getting these vaccines sometime, hopefully, again, in January. I asked him the three simple questions. When are we getting it? What type of vaccine are we getting? And how much of that vaccine are we getting? To have General Hillier make a proper plan, we need to know. It's no different. He needs the ammunition. before we go to war on this. And again, we need the answers from the federal government, and we will work hand in hand collaboratively with the Prime Minister and his entire team, along with municipalities, as we have throughout this whole pandemic. I'll pass it to General Hillier.
Brian, thank you. Good to hear your voice again. And I'm not driving the car now when you're talking to me. Look, last time I worked very closely with Major General Danny Fortin was in Afghanistan. I was the commander of the International Security Assistance Force, the NATO forces there. He was running operations for the Canadian Brigade, which was part of that force. He is the most incredible leader that I can imagine. I could not praise him enough. I am so absolutely delighted that he is commanding the task force. We as a nation are blessed by having him in that position. He's an incredible leader, so I look forward to working with him as closely as possible. I saw him on Friday afternoon in Ottawa, and he's still trying to understand the full ramifications of his mission and what he's going to do, and no doubt he'll be all over it. He's an excellent leader. We are lucky as a nation to have him. Look, let me just say a couple of things here while I'm here and talking to you, Brian. I'll use you as the mouthpiece here too. So I'm glad that the Premier and the Minister have confidence in me, and I hope that they continue to have that confidence when we hit that first speed bump that the Premier described and people start screaming, because we will. And they will. But we're going to get through this. We're going to be ready to do it, and we'll learn from everything that goes wrong. Secondly, it's not all pessimism here. I know we're all anxious for the vaccines to arrive. We're all tired of the pandemic and the kind of lives we're forced to live. But just think, 4 or 5 weeks ago, it was if we get a vaccine. And now here we've crossed a nexus here. We've changed how we're looking at things. We have vaccines on the way. Yes, we want them all tomorrow, but what a change in tempo that's been. And the last thing I'll say, and I'll get away from here, is, I had the chance to interact over these last days here with some of the most incredible, professional, intelligent, dedicated, committed Canadians that you could ever meet in the Ministry of Health and the Solicitor General, other parts of the Government of Ontario, the police forces, City of Toronto, and responders, and oh my goodness, those folks are incredible, and the people of Ontario don't get to see as much, don't get to hear as much of just how incredible they are, how hard they're working, how dedicated they are, how professional they are, and how they want to make this vaccination rollout, the war against COVID-19, how much they want to make that a victory, and also how tired they are. And we've got to re-energize them, we've got to resupply them, we've got to make sure that they're focused and they've got all the support that they need to finish the last part of the battle in this pandemic. Obviously, that's what I'm committed to trying and do in my part of it. But again, I just want to say to those folks, thank you. I'm proud to be Canadian every time I'm around you, and every time I see what incredible commitment, professionalism, and dedication that you have. Thank you. Thanks, Brian.
Follow up, and this will be the last question.
Premier, I'd like to ask you about the idea of manufacturing at home. You raised this yesterday, and I'm wondering if you've raised it with the Premier, if you've had conversations with industry leaders about whether we can manufacture some of this vaccine at home. But while I'm mentioning home, you're also apparently having protesters show up at your home, not just yesterday, but over several weeks, and I'd like to hear your thoughts on that as well.
Yeah, sure. Well, thanks for the question, Brian. I'll answer the first question. We have been in contact with the manufacturers of pharmaceutical companies here in Ontario. We have a tremendous amount of them. And if I can explain it this way to the folks out there, there's co-packers out there in industries or companies that will bottle items or manufacture items for other people. That's what I'm encouraging them to do. Work with some of these pharmaceutical companies that have the vaccine. If they don't have the capacity, let's get the capacity going here in Ontario, and we'll work with them, we'll support them any way we can. So we have been in conversations with the folks in the pharmaceutical industry, and they've been very, very good conversations, and I want to thank them. They're stepping up to the plate any way they can. This is a call out to the people of Ontario, and a call out to the protesters. Every single day, my friends, there's protesters outside my house. It doesn't affect me. I'm not there. I have the best neighbors anyone could ever ask for. They didn't sign up for this. They aren't making decisions for the government. It is totally unfair. It's unacceptable that they have to put up with this because they're living beside the Premier. This, and I wouldn't care if it was Kathleen Wynne or Mayor Tory or any other politician. This is totally unacceptable that my neighbors are being intimidated, being threatened, and these people, they need to stop. You want to protest me? Come down to Queen's Park. You can do cartwheels, you can jump up and down. But there's an unwritten rule here in Canada, unwritten rule, you don't go after people's families and neighbors. Come after me. Don't come after my neighbors. And I want to sincerely apologize to my neighbors that you have to go through this every single day. I love my neighbors. I'm very grateful for their support, but please leave them alone. And if you think, the protesters think, that this is going to change my opinion on anything we have a decision to be made because you're protesting, I can assure you that will never, ever happen. So please stop protesting, because these are small business owners on my street that are struggling, and streets all around the neighborhood. That's who you're hurting. And I can assure you another thing. It's not small business owners that are protesting in front of my house. They're special interest group, political groups. It's unacceptable. And stop acting like a bunch of buffoons out there and start respecting the people of Ontario. You want to come at me? Come at me. Leave my family and leave my neighbors alone. Thank you.
Thank you, everyone.
I wish everyone a good weekend. Thank you.